Hello, everyone. Welcome back to my channel. I'm Dr. Laura, your go-to source for men's health and wellness. Today, we're diving into a topic that sparks curiosity, raises questions, and sometimes comes with a bit of stigma. Does masturbating every day affect your prostate health? Is it good for you, harmful, or somewhere in between? I'm here to break it down with science, bust some myths, and share practical tips you can use. If you love learning about how to stay healthy and thrive, hit that like button, subscribe, and drop a comment with your thoughts. It helps me bring you more content like this. Oh, and don't forget to ring the bell so you never miss a video. Let's get started. Masturbation is something most men engage in at some point, yet it's surrounded by conflicting information. You might have heard that it's bad for your health, causes infertility, or even weakens your body. On the flip side, some say it's a natural way to boost wellness. So, what's the truth? As a doctor, I want to clear up the confusion and empower you with facts, especially when it comes to your prostate, a small but mighty gland that plays a big role in men's health. First, let's talk about what the prostate does. The prostate is a walnut-sized gland located just below the bladder, surrounding the urethra. It produces seminal fluid, which nourishes and transports sperm during ejaculation. A healthy prostate is crucial for fertility and overall well-being, but it's also prone to issues like inflammation, enlargement, or even cancer as men age. So, does frequent masturbation, like every day, help or hurt this vital gland? To answer that, we'll look at what science says, explore the benefits and potential risks, and give you practical advice to keep your prostate in top shape. What studies say about masturbation and prostate health? Let's dive into the research. One of the most significant studies on this topic comes from Harvard University, published in 2016 in European Urology, a leading urology journal. This study tracked 31,000 men over 18 years, pretty impressive, right? Here's what they found. Men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. That's a big deal. Why might this be? Ejaculation could act like a cleanse for the prostate. It helps flush out potentially harmful substances, like inflammatory compounds, that might build up and contribute to chronic inflammation, a known risk factor for prostate issues. Think of it as a natural way to keep the pipes clear. But that's not all. Orgasms, whether from masturbation or sex, release endorphins and oxytocin, feel-good hormones that reduce stress and promote relaxation. Since stress can worsen inflammation and affect hormonal balance, this is another way frequent ejaculation might support prostate health. Another study, published in 2017 by the Journal of Sexual Medicine, echoed these findings. It suggested that regular ejaculation in your 20s and 30s could have a protective effect against prostate cancer later in life. While more research is needed, the evidence so far points to a potential benefit, especially for men who ejaculate frequently but not excessively. Busting myths, what masturbation doesn't do. Now, let's tackle some myths head-on. There's a lot of misinformation out there, and I want to set the record straight. Myth number 1, masturbation causes infertility. Absolutely not true. Masturbation doesn't affect sperm production or quality. Your body continuously produces sperm, and ejaculation simply releases what's already there. Infertility is usually linked to other factors, like hormonal imbalances or medical conditions, not masturbation. Myth number 2, masturbation weakens your body or drains energy. This is an old wives' tale, often rooted in cultural stigma. There's no evidence that masturbation depletes your strength or vitality. In fact, the stress relief from orgasms can make you feel more energized. Myth number 3, masturbation prevents all prostate problems. While frequent ejaculation may lower the risk of prostate cancer, it's not a cure-all. Conditions like benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, or prostatitis, an inflammation often caused by infection, aren't directly influenced by ejaculation frequency. These require other preventive measures, which we'll cover soon. By debunking these myths, I hope you feel more confident about what masturbation does and doesn't do. Knowledge is power, and understanding your body helps you make informed choices. The flip side, when masturbation might be too much. So, if masturbation can be good for your prostate, is there such a thing as too much? The answer depends on how it fits into your life. For most men, masturbating daily is perfectly fine. It's a natural part of exploring your body and managing stress. But there are a few signs that it might be tipping into unhealthy territory. First, if masturbation becomes compulsive, meaning it's interfering with work, relationships, or daily responsibilities, it could signal an issue. For example, some men report feeling emotionally drained or disconnected from their partners if masturbation replaces intimacy. Second, excessive masturbation might cause physical discomfort, like sensitivity in the genital area or difficulty maintaining an erection during partnered sex. This is often temporary, but it's a cue to dial things back. Finally, for some men, frequent masturbation tied to pornography can create unrealistic expectations about sex, which might strain relationships. The key is balance. Masturbation should enhance your life, not take over it. If you're wondering, how much is too much, there's no universal number. It's about how it feels for you. If you're concerned, consider talking to a doctor or therapist for personalized guidance. Masturbation is just one piece of the prostate health puzzle. To keep your prostate in top shape, here are 5 practical tips I recommend. 1. Eat a prostate-friendly diet. Focus on fruits, vegetables, and healthy fats. Tomatoes, rich in lycopene, nuts, and fatty fish like salmon are great choices. Limit red meat and processed foods, which can increase inflammation. 2. Stay active. Regular exercise, think 30 minutes most days, improves blood flow and reduces inflammation. Kegel exercises, which strengthen pelvic floor muscles, can also support prostate health. 3. Get regular checkups, starting at age 50, or 45 if you're at higher risk, like African American men or those with a family history. Get a prostate-specific antigen, PSA, test and a digital rectal exam. Early detection saves lives. 4. Manage stress. Chronic stress can worsen inflammation and hormonal imbalances. Try mindfulness, yoga, or hobbies you love to keep stress in check. 5. Communicate with your partner. If you're in a relationship, talk openly about your sexual health. Masturbation can be a healthy part of intimacy, but mutual understanding strengthens connection. These habits, combined with moderate ejaculation, create a solid foundation for prostate wellness. So, to wrap up, masturbating every day can have benefits, like a lower risk of prostate cancer and stress relief, but it's not a magic bullet. Balance is everything, and pairing it with healthy habits like a good diet and regular checkups is the way to go. Every man's body is unique, so listen to yours and don't be afraid to seek advice if something feels off. Now, I want to hear from you. Have you ever heard myths about masturbation and prostate health? What's one health habit you're curious about or already doing to stay well? Drop your thoughts in the comments, I read every one. If this video helped you, give it a thumbs up, share it with a friend, and subscribe for more men's health tips. Next week, I'm sharing 5 foods that boost prostate health. You won't want to miss it. Thanks for watching, and I'll see you soon with more ways to live your healthiest life. Stay well.